Dr. Agari, welcome.
Thanks for having me.
So let's crack right off with it. Could you please introduce yourself to your adoring fans out there and tell us a little bit about who you are and how you got here?
Of course. So, my name's Dr. Kristi Agari. I am an oral surgeon practicing here in Las Vegas. I'm about to open a new office called Blue Diamond Oral Surgery. But how I got here, I was born in Stockton, California, and I went to high school there. I went to college there at the University of the Pacific. UOP has a pre-dental program. That's how I originally got into dentistry. I ended up applying though. I applied to University Pacific and I got in. I also applied to University of Nevada, Las Vegas, and I got an interview. I said, let's show up, right? Let's show up to the interview. Let's see what's going on there. I interviewed at Las Vegas, at University of Nevada, Las Vegas, and I loved it. When I interviewed there, I knew that that was my home. And I was so happy I got accepted. So I ended up going to dental school at UNLV here in Las Vegas. I graduated in 2018. And then I left to go do my oral surgery residency at USC, the University of Southern California. I went to medical school at Keck, finished my residency there, but I always miss Las Vegas. Even moving back to California, which, is where I was born, I knew, Las Vegas was my home. So that's what made me decide to move back to Las Vegas and practice here.
It's wonderful. So, from my research, it sounds, as you just explained, like you've been to a lot of very interesting and amazing places, done your studying out at USC. What was it about Las Vegas that drew you back here and made you want to set down roots in our humble town?
Las Vegas is, first off, it's so fun. There's so much to do here. The food here is amazing. I feel like I'm a big foodie. Um, even though the weather could be hot, they say it's just a dry heat, but the weather here is actually pretty nice, minus the hot months. And then above all of that, I just love the community. I feel like there's more a sense of togetherness here, whereas in California, there are so many smaller communities that it's harder to branch out. It may be harder to branch out of your own smaller community there in California. Las Vegas, like I said, I feel more togetherness here.
Well, I can assure you, we in our teeth are very grateful to have you here. So, I have to confess, I'm a little intimidated sitting across from you. You are an oral surgeon, and that's not something that everybody gets to do. What motivated you to pursue that as your profession?
So originally, like I said, I really got into dentistry both from the college that I went to and family friends that we had who were dentists. They had encouraged us to enter dentistry because it was such an eclectic field. You're you're both a scientist and you're working with your hands, but you're still working with the community and you're your own business owners. So that's how I got into dentistry as a whole. When I went into dental school, I started learning about the different specialties within dentistry, and I discovered oral surgery both through my studies and because I have a sister that was also in dental school a couple years ahead of me. She also learned about oral surgery, and we both discovered that it was just an awesome field where um, you are doing very what's the word, like very advanced surgical procedures that are very fulfilling. So that's how I ended up going deeper, down my dental studies into a specialty of oral surgery.
So it sounds like this particular field of medicine was a familial passion. Your sister Kimiko is also in the same career path a couple of years ahead of you. What was that like, having that family connection as you're both studying and working your way up?
I don't know how I would have done this without having a sister in the field, because not only do I feel like she's my best friend just as my sister, but now I have a best friend that's experiencing the same things that I am going through. She has experienced what I've gone through. I've experienced what she's gone through, and what we are doing is so specific and specialized. It's very hard to relate it's very hard for others to relate to us for very specific things. If, say, we had a very difficult surgery or a difficult case, or we're just trying to problem solve a very unique uh, like diagnosis that a patient may have. So it just feels so wonderful and special to be able to just pick up the phone and call my sister, call my best friend, and just like, hey, I have this thing going on. I think we need to put our heads together and figure this one out.
I think you chose the appropriate word there. It must be wonderful having your best friend available and on call, if you will, to commiserate with and help you out in your practice.
Oh yeah, and and because she's my sister, she's on call exactly, and I'm on call for her. Like she has to pick up the phone for me, and I will always pick up the phone for her too.
You probably don't charge each other too much either, do you?
No, it's free.
That's sure you're both grateful
Free
for that.
consult, free curbside consult.
I love that.
Yeah.
So tell me a little something. Early on in your career, what were some of the keys to success that you found yourself implementing as you were studying, as you were in residency, as you were establishing yourself as an oral surgeon?
Yeah, keys to success. I would say main key to success is having a good support system. So for me, like I said, I don't think I could have done this without my sister because she is an oral surgeon, or she was training to be an oral surgeon while I was training to be one. Having a support system, someone that you could talk to, having different hobbies to de-stress, because work isn't everything, and you'll drive yourself crazy if you don't let your mind experience other things besides studying and practicing your surgical techniques. Always preparing, at least trying to be a step ahead of the game. If you have surgeries that are coming up, you have to read about them. You have to know your patients well, do the prep. I would say those are the top things.
Sounds like you were well established for success from the beginning. So, speaking of some of those things that help you succeed, you mentioned your hobbies. Tell me a little bit about Dr. Kristi outside of her practice. What's she like? Where can we find her on the average Saturday?
You'll probably find me in a hot yoga studio. I love hot yoga. During the winter months, I love skiing, although I haven't been skiing as much because now I really have to protect my hands and protect my body. I don't want to get any injuries. I love going to comedy clubs. Me and my partner love stand-up comedy, going to shows. We love going to concerts. So you might just find us at like when we were young in Las Vegas. And I used to go to Life is Beautiful when I was in dental school, although they didn't have Life is Beautiful last year. So I was really bummed out about that.
Hopefully, they bring that back soon.
Yeah.
So, I also have someone in my life that's in the medical field, and something I've heard a lot about is the challenges that residency can present. What was that experience like for you, and how did you support yourself and keep yourself centered while you were going through that?
Yeah, residency, you're familiar with it. It's very strenuous because you can, well, specifically for oral surgery, our rules in the hospital are a little bit different than other residency programs because we may not have post-call. So post-call is a time period that you are allowed off once you're on call. Once you've been on call for about, say you're on call for 24 hours, you definitely get the next day off, right? It may not always apply with oral surgery because it's just different guidelines. It's a dental specialty, not a medical specialty. So you might be on call and then you still have to work the next day and round at 6:30 in the morning, 7 a.m. Yeah, it could be very strenuous. So with that said, getting through residency, again, it's finding your support system, finding your co-residents who you can talk to about what you've been going through, just to commiserate together. If you are going through it, then your co-resident probably went through it too, or the years above you. Making sure that you eat healthy. It's really hard to eat healthy during residency because you eat the free food that's in the cafeteria. And if you had a choice between like a tofurkey salad or like chicken tenders, of course you're gonna take the chicken tenders.
Oops,
I know,
how'd that happen?
but yeah, try to eat healthy, and identifying just what helps you de-stress, because everybody is different. Everybody has different things that um, helps take the stress off, whether it be exercising or whether it be just meditating, setting aside even 10 minutes, being mindful of setting aside just a certain amount of time that works for the person. So if you only have 10 minutes, as long as you did your 10 minutes, or if you only have an hour, as long as you dedicated that hour.
I don't
Yeah.
envy you going that, but you are a real Iron Woman for surviving through it. That's the one thing I know and have heard about residency. So moving forward, it sounds like this has been a passion, a familial passion, even for you since a young age. What were some of the role models that you had that you looked up to growing up?
Oh, 100% my mom and dad. My mom and dad were my main role models. Uh, I saw what they went through to put us through school, to make sure that we had to feel like we were worth it, that we were worth having, nice things, or even when I say nice things, just um, at least feeling like we fit in. They didn't want us to feel like we couldn't afford the nice things, so they worked extra hard so that we had a very good childhood. I saw their work ethic, and I always knew I wanted to be just like them. Yeah.
That's wonderful. I don't want to make you blush here, but speaking of role models, I did get the opportunity to meet your dear mother, Wendy, as she was walking in the studio before we got started here. And I got to say, it's got to be incredibly rewarding for her to watch you succeed. In that vein, what's the most rewarding thing about what you do?
I really feel so much satisfaction when I know I had a good outcome. It may not be something that other people can understand, which is why I I take so much joy and comfort sharing those successes with my sister, because she understands the feeling. But when I have a very good surgical outcome and the work looks beautiful, the patient is happy, I really feel just a sense of satisfaction, you know? And I think when other people in their fields, when they did a good job, or when they really feel fulfilled with their work, I think they would resonate with what I'm saying.
Wholeheartedly understand. And it's not an exaggeration to say that you change lives every day. I commend you for that. So there's the good, but I got to ask you about the flip side of the coin. What's the most challenging thing about what you do?
Yeah, probably the most challenging thing would be when we are, for whatever reason, I'm unable to communicate well with a patient so that we are on the same page about ultimately providing the best care for them. Sometimes with dentistry, the topics or the surgeries that we need to explain or illustrate can be difficult to understand. And sometimes patients may not understand the choices that we make are to have a specific outcome and a good outcome. Uh, and sometimes it's not easy for anyone to understand what we're trying to convey. And so uh, it sometimes it's difficult to carry out a surgery that the patient maybe not understand. And ultimately we can't do a surgery unless they consent to it. We get informed consent, and every now and then, nothing in this world is 100%. Even surgeries across any specialty, um, even if all your surgeries are 99.9%, there's always that 0.1% that you may not have the most optimal perfect outcomes. And that is the difficult part about this job, because when we're working on our patients, we want the best for everyone. We want every outcome to be perfect. Uh, the good news is, though, that say, an outcome is not achieved that we'd like, I'm here, and the surgeons that I work with, we're always here to continue to make those outcomes better. Yeah.
I like that. Well, it sounds like between people skills, your incredibly hard work ethic, doing what you do, and obviously your skill with your hands as a surgeon, you've picked up a myriad of disparate skills along the way to getting where you are. Could you tell me what one of those that you've picked up along the way that you think has been most important to your success?
Like hand skills or
You can pick anything. What's a skill that Dr. Christie thinks when she looks back has been invaluable to putting her on the road to where she is today?
I I used to crochet actually, like crochet and sew, and I feel like in a way that hand-eye coordination helps with this. Also playing video games. I
Okay.
actually really do think that playing video games helps with hand skills, dentistry, like that hand-eye coordination,
I like that.
And it's actually this past weekend, I whipped out our old Nintendo 64. Did you ever have a Nintendo 64? Yeah.
Oh, my dear.
So, it's I don't know if this is kind of lame, but actually in Pokemon Stadium and Kirby and the Crystal Shards, they had mini games. They're
Mm-hmm.
so fun. And so we were playing them this weekend, and I kind of was like, oh, wow, I'm kind of sucking right now. Like, what happened? And so there must have been a time where I was like really good with the video game hand-eye coordination. Like, if you could do that, I think that you'll be good with, say, like doing lap colis, doing laparoscopic surgery. I think, not that I do laparoscopic surgery, but I'm like, okay, I think that you have to be pretty good at video games to do this laparoscopic surgery pretty well.
Once upon a time, a video game helped me ace a spelling test in fourth grade, and I never ever let my parents forget about
Oh
it. So
yeah,
don't
well,
let them think that it can't teach you skills. It's
I
very
think it's pretty
valuable.
good. Yeah.
I'm going to go on a little bit of a tangent here, but you've mentioned it, and it's something that's near and dear to my heart. I'm a bit of a gamer as well. What's your favorite console generation?
Oh.
You a Nintendo girl?
Uh, I I always go back to the Nintendo 64, but we had a PS2 and I would play Dance Dance Revolution
Yes.
like every single day at least for an hour. I think I was really good and I played mostly on the PS2 for that. So I would say and we played Rock Band. We would have these Rock Band parties and these Guitar Hero parties. Our friends would come over. I can't believe our parents let all our friends come over and like we would keep them up all night. I feel so bad for our parents. Probably the PS2 just because of those games. And I played a lot of Kingdom Hearts. Did you ever play Kingdom Hearts?
I never got to that, but I feel strongly about the PS2 as well. I was more of a Metal Gear Solid kid.
Okay. Yeah, yeah. Oh, and they had all the Grand Theft Auto games. I feel like it was pretty good on the PS2.
I feel like Dance Dance Revolution was the original edition of Wii Fit Sports.
Oh,
It's
yeah.
coordination and cardio,
Oh,
you
yeah.
know?
Actually, on the Wii, I would play Just Dance a lot.
Nice.
I have all the Just Dance games, and I still buy them on because I have a Nintendo Switch, so I'll play it on the Switch.
You must be
Yeah.
a terror on the dance floor.
No, I'm only good at, just really lame arm movements with the
It's okay, so
console.
do I.
Yeah, those are so fun.
So, a lot of people may know you as Dr. Christie, the oral surgeon, but what's an unexpected fact about you that a lot might not?
That's another hard question. Oh, I'm a twin. Yeah, an unexpected fact is that I'm a twin.
My God, there's
Everyone's
two of you running around out
yeah,
there?
everyone's always see to me it's normal. I'm like that's not unexpected. I was born and I was a twin, so to me I'm like that's my whole life. But yeah, I always have to take a step back and be like, oh yeah, I have a twin, but I have a twin brother. He lives in Dallas. He's an accountant. Uh, yeah, people are always so surprised. Even I want to say just yesterday, one of the assistants, I mentioned my twin, and the assistant looked up and they were like, "Doctor, you have a twin?" Yeah, it's. I feel like maybe once a month, I tell someone I'm a twin, and people are just they lose it. They're so surprised.
Yeah, I don't think the world could handle two of you. I'm
Yeah,
scared now.
and when they always think, then they are like, "Oh, Kimiko, my sister must be your twin because you guys are both oral surgeons." I'm like, "No, no, she's my older sister. I actually have a different twin."
What's his name?
Kenji.
Genji?
Kenji. Yeah.
Hi there, bud. Sister's a star. Congratulations. So, looking back through your career, what do you think is something unexpected that helped put you on the road to where you are today?
Okay, so when I was in high school, um, I learned more about my Japanese heritage. I'm fourth generation Japanese American. I don't speak Japanese. It's very common fourth generation Japanese people to not know Japanese, partially because we've been in America for so long, and then partially because of the internment of Japanese people during World War II. Japanese people really wanted to show allegiance to America, and they weren't encouraging their children to speak Japanese or have Japanese customs. They want their kids to be more Americanized, right? And then the internment happened, and just the way Japanese people in America are, they're very keep moving forward, put your head down, get through it, keep moving forward. So they don't talk about past tragedy or past things that happens. If they hit a roadblock, just it's okay. Don't forget about it. Don't talk about it. Just keep moving forward. I don't know that mentally that would be considered healthy nowadays, but it's how my generation got through what they experienced. Um, Japanese people during that time, if they were in high school, medical school, what have you, they were forced to leave their studies and be interned in these camps. And so I learned about this when I was in high school, and I had this project where I located um, Japanese people who were interned during World War II who were not able to get a high school diploma, and we helped reconnect them with the Stockton Unified School District to get them the diplomas that they were never able to get, that they were never able to finish their high school career. And it was probably the first project that I was really passionate about in my young life. It just, I got to be involved with the community. It was the first time that I was involved with public speaking. It was the first time that I got to know more about myself, my ancestors, and the first time that I just got to help somebody. And I don't like to talk about it a lot because it's not about me. It's about my ancestors and these Japanese people who didn't get their high school diploma. It's about them. But in my life, it was the first time that I was a part of something like that, and I think that really set me in a different direction of knowing what it was like to help other people or be involved in something bigger than myself. Yeah.
That may be a painful subject for you, but I hope I think it is positively wondrous the way you touched so many people's lives and impacted them for the better.
I
Congratulations to
appreciate it.
you on
Thank
doing that.
you. Thank you. I see. I appreciate the congratulations. But yeah, I like to congratulate them because they're the ones that they went through this this big event in their life and they got through it, and now those people are my grandparents, or now I guess grandparents that are long past now, but my generation just wouldn't be here without them and the hard work that they put in, because they had to start from zero to nothing, and now I'm here sitting here as a surgeon. I wouldn't be here without them.
Well, they may have done the work, but you were their hand up. I commend you for that.
Thank you. Thank you.
So, moving forward into the future, you've already established yourself quite well out here at Henderson Oral Surgery. Did I get that
Yes.
correct?
Yeah. Right.
Wonderful.
Yeah. Right now, I'm working with Dr. Steve Huang at Henderson Oral Surgery and Implantology, but we are going to open our new office soon.
Well, that's just what I was going to ask. How does Dr. Kristi see herself growing her skills and her practice into the future?
Yeah. So, yeah, we're going to open our new office, Blue Diamond Oral Surgery. Uh, when I started, there were certain techniques that um, I hadn't incorporated into my practice, so I didn't do as many immediate implants. Now, I think immediate implants are the best solution for a patient for replacing their teeth. It cuts down the time that they are going edentulous in that area. I started doing apicoectomies. That's not something that's routinely taught in residency programs. And that is something that maybe not a lot of oral surgeons feel comfortable doing. But I do more apicoectomies along with, third molar removal, extractions, pathology, conservative TMJ management, and arthrocentesis, things like that.
That's awesome. Dr. Kristi, this conversation has been enlightening, dare I say, revelatory for myself, and I know our viewers out there. I have one last question for you that I like to ask all the guests that come into this studio. What is a piece of advice that you would give to someone that wants to be in your shoes one day?
Yeah. Oh, I have so much advice.
Oh, please. We have all the time.
Yeah. If there's someone out there that wants to be an oral surgeon, um, you have to work hard. You have to remember where you came from. And you have to remember that feeling of wanting wanting to succeed or wanting to be a surgeon or wanting to help people. You have to remember that feeling because the road is very tough. The road is very tough. The road is very long. A lot of blocks. And when you're going through those tough times, you have to remember where you were, say, a year ago or 2 years ago, and remember that you would have traded anything to be in that position. It's easy to look back. It's hard to look forward, right? But you have to work hard. You have to put in the time. You have to follow good advice. There are a lot of people out there that want to give advice, and you're gonna have to be able to recognize what's good advice and what's not so good advice. The best way to figure out if it's good advice is that person successful? Is that person a surgeon? If they're a surgeon, they probably have good advice, and you have to listen to them. There is a very difficult exam that one must take in dental school in order to get into oral surgery. When I'm advising dental students, I'll tell them like, hey, you have to get at least this score on the exam or it'll be very difficult for you to get an interview. And there are some students, for whatever reason, they will say, I didn't do so well, so I think I'm going to try these other things. Like I'll do more extracurriculars here. And it's just a toss-up for them if they're going to get interviews or not. Whereas the kiddos who they're like, okay, I'll do well. They get the score that we forecast should be pretty good. They always get all the interviews. Like follow the good advice, because it's at this point, there's no use in reinventing a wheel, right? So I don't think it's always good to reinvent the wheel. There are some areas where you need to be innovative and you need to be yourself, and it's okay to be unique. But there are other rules that just must be followed, Yeah, and again, taking time for yourself, staying grounded. You got to put in the work. A lot of people who I went to school with who wanted to get to where I am today, or maybe other years below me who've wanted to get here. I feel like the biggest denomination, if they didn't get there, was that they didn't put in the work. But my other advice is if there's any inkling that you don't like the field that you think you want to go into, you shouldn't go into it. Some people, for whatever reason, they really, really want to, say, become a surgeon or become a dentist or become an engineer, and it's almost like they're forcing themselves to be that thing for whatever reason. And I don't know that they will be happy like inside if they're forcing themselves to go there. You have to really like this. And especially in oral surgery, when we're working on people are entrusting us with their healthcare and their surgeries. You can't do this every day if you don't like it. You're not going to have good outcomes if you're not enjoying yourself.
You are a font of wisdom. Sounds like if
I don't know
someone
if all
needs...
that is so dark. Like, I don't want it to be so dark.
Sounds like if someone needs good advice, they just need to come find you.
You guys have to edit.
That's what the boys in the back are good at.
They might have maybe 3 minutes of really good footage and like 10 minutes of darkness.
You provided us with so much more than you know.
Oh, no.
Dr. Kristi, I wanted to thank you so much for coming out today. It has been wonderful talking to you.
I had a great time. Thank you so much. It was great getting to know you too.
Thank you very much.
Thank you.
Ladies and gentlemen out there, thank you for joining us once again in the Subsidy Studios podcast. I'm Spencer Gallagher. She is Dr. Kristi Agari. Have a great night.